Hi, community leaders. I'm Dr. Walker. I've had a lot of emails coming in over the last couple weeks just asking about Omicron. Is it more severe? Do we need to panic? What's happening? And so I don't have very many answers for you, but I do want to walk you through a timeline and I want to walk you through how we collect data and kind of paint a picture of disease. Then just some basic considerations and questions that we should be asking about different populations. And then also just to have a little knowledge about the variant of concern list. And so the first one is studies. And so when we gather new information about a disease, there's two areas that we really gather information from. The first one is the lab. We look at what does this look like biologically? What does this look like with vaccines? And really that side of disease. And then we look at epidemiological studies. And that's just really how does the disease look in the population? How is it spreading? Who's being impacted? Kind of the real life studies. And so it's really this merging of those two worlds. We merge the lab studies and the real life studies, and we paint this picture of disease. And one study doesn't give us all the answers, as much as the news portrays that. We need a lot of studies and we need large sample sizes to really paint this picture of what this new variant looks like. So far, there have only been about 8 studies released, and they're mostly in the lab. And some have as few as 12 participants, which is a very, very small sample size. So it's just going to take time to really see the data from multiple sides and multiple studies to get a good picture of this disease. The second thing I want to just kind of spark some interest and hopefully stir some questions around is really thinking about the context of the population. And I just feel like this is so important because every population is so different, and that really impacts how disease spreads. And so I've done a lot of research in different African countries with HIV, and that's usually my area of study. And knowing what I know about Botswana and South Africa, they have some of the highest rates of HIV in the world. Almost 1 in 4 people are infected. And what we know about HIV is that it completely destroys the immune system. And so people who live with HIV are more vulnerable and at risk for even mild diseases to hurt them. And so that should just raise some questions for us around, did this mutation happen because the virus is trying to learn to live in people who have suppressed immune systems? We don't know. Is it more mild because of that? We don't know. Did this spread more quickly because there are so many people with suppressed immune systems? Again, we don't know. Are hospitalizations mostly people that have HIV, or is it a wide range? I haven't seen data on that yet, so we just don't know the answer. But those are just some population context questions that we should be asking and we should be looking at in those epidemiological studies. The third thing I just wanted to mention is just around the variant of interest and the variant of concern list that we see globally. And these are lists that are out all the time for other diseases as well. But it's just in this new season of the pandemic where the news is really picking up on when there are changes to those lists, the day that they happen, and kind of spread them in the news and cause fear and panic. And so I want you to know that there have been a number of variants on the variant of interest list and the variant of concern list that have done nothing. And so again, it's just that waiting period that we need to walk through. And we really won't have a good idea about severity of disease for another couple weeks because hospitalizations and death usually take at least 3 to 4 more weeks from initial infection to really see what they look like and to see how they impact people. So we still have a couple more weeks to wait. And so I just encourage you to not panic in this season, but just to kind of be uncomfortable in this waiting, but just know that we're trying to gather information and do this in a good way so that we can paint a picture of disease. And the good news is that we just already know the mitigation efforts that we can take. We know what we can do to protect other people, and that won't change. So I hope you're encouraged as you kind of wait in this awkward time period as we get more data to collect to really see what this looks like.